Hello, nursing students. Welcome to Nursing Exam Preparation, your go-to channel for excelling in nursing exams with confidence. In today's video, we'll guide you through 150 multiple-choice questions, MCQs, on anxiety disorders, each carefully designed to challenge your understanding and expand your knowledge of this essential topic. Detailed explanations follow every question, helping you not only answer correctly, but also grasp the reasoning behind each answer. Whether you're just beginning your studies or revising for your exams, this video is packed with content to test your skills, enhance your critical thinking, and reinforce fundamental concepts related to anxiety disorders. Don't forget to like this video, share it with your fellow students, and subscribe to Nursing Exam Preparation for more invaluable resources. Be sure to hit the bell icon to stay updated on our latest videos, all designed to help you succeed. Once you've completed the video, let us know your score in the comments below. We'd love to hear how you did. Let's dive in and work toward mastering anxiety disorders and achieving exam success. 1. Which of the following is a key feature of generalized anxiety disorder, GAD? Excessive worry about multiple areas of life. Intense fear of specific objects or situations. Persistent fear of being judged in social settings. Recurrent panic attacks with no identifiable trigger. Answer: excessive worry about multiple areas of life. Rationale: generalized anxiety disorder, GAD, is characterized by excessive worry about multiple life domains for at least 6 months. Option B describes specific phobia. Option C describes social anxiety disorder. And Option D describes panic disorder. 2. What is the first-line pharmacological treatment for generalized anxiety disorder? Antipsychotics, benzodiazepines, selective serotonin reuptake inhibitors, SSRIs, tricyclic antidepressants. Answer: selective serotonin reuptake inhibitors, SSRIs. Rationale: SSRIs, such as sertraline and escitalopram, are considered first-line treatment for GAD due to their efficacy and safety profile. Option A, antipsychotics, is not commonly used. Option B, benzodiazepines, is for short-term use due to risk of dependence. And Option D, tricyclic antidepressants, have more side effects. 3. A client experiencing a panic attack is likely to present with which of the following symptoms? Persistent sadness and fatigue. Increased heart rate and shortness of breath. Difficulty remembering names. Disorganized speech and hallucinations. Answer: increased heart rate and shortness of breath. Rationale: panic attacks are characterized by sudden physical symptoms such as tachycardia, shortness of breath, chest pain, and dizziness. Option A describes depression. Option C is unrelated to panic attacks, and Option D is more characteristic of psychosis. 4. Which therapy is considered most effective for social anxiety disorder? Psychoanalysis, electroconvulsive therapy, ECT, cognitive behavioral therapy, CBT, hypnosis. Answer: cognitive behavioral therapy, CBT. Rationale: CBT is the most evidence-based and effective therapy for social anxiety disorder, helping clients identify and challenge negative thoughts while gradually exposing them to social situations. Option A, psychoanalysis, is outdated. Option B, ECT, is not used for this condition. And Option D, hypnosis, lacks sufficient evidence. 5. Which neurotransmitter imbalance is commonly implicated in anxiety disorders? Dopamine, serotonin, glutamate, acetylcholine. Answer: serotonin. Rationale: serotonin imbalance is strongly associated with anxiety disorders, leading to excessive worry and fear. Option A, dopamine, is more relevant to psychotic disorders. Option C, glutamate, is implicated in excitotoxicity. And Option D, acetylcholine, is not central to anxiety disorders. 6. A client reports intense fear of heights that prevents them from climbing stairs or crossing bridges. What is the most likely diagnosis? Panic disorder, social anxiety disorder, agoraphobia, specific phobia. Answer: specific phobia. Rationale: a specific phobia is characterized by an intense fear of a specific object or situation, such as heights. Option A, panic disorder, involves recurrent panic attacks. Option B, social anxiety disorder, involves fear of social judgment, and option C, agoraphobia, involves fear of open or crowded spaces. 7. Which of the following is a hallmark symptom of panic disorder?
Persistent worry about health.
Excessive fear of criticism. Recurrent, unexpected panic attacks. Fear of separation from loved ones. Answer: recurrent, unexpected panic attacks. Rationale: panic disorder is defined by recurrent, unexpected panic attacks and fear of their recurrence. Option A, worry about health, relates more to illness anxiety disorder. Option B, fear of criticism, is a symptom of social anxiety disorder. And option D, fear of separation, is indicative of separation anxiety disorder. 8. A nurse is educating a client about relaxation techniques to manage generalized anxiety disorder. Which technique is most evidence-based for this purpose? Guided imagery, progressive muscle relaxation (PMR), rapid eye movement, light therapy. Answer: progressive muscle relaxation (PMR). Rationale: PMR involves tensing and relaxing muscle groups systematically, helping reduce physiological tension. Option A, guided imagery, is beneficial but less structured. Option C, rapid eye movement, is unrelated. And option D, light therapy, is used for conditions like seasonal affective disorder, not anxiety. 9. Which medication is most appropriate for immediate relief of acute anxiety symptoms?
Sertraline.
Alprazolam.
Buspirone.
Propranolol. Answer: alprazolam. Rationale: alprazolam, a benzodiazepine, provides immediate relief of acute anxiety symptoms. Option A, sertraline, is an SSRI requiring weeks to take effect. Option C, buspirone, is not for acute relief. And option D, propranolol, is effective for physical symptoms like tachycardia, but not the anxiety itself. 10. What is the primary focus of cognitive behavioral therapy, CBT, in treating anxiety disorders? Exploring unconscious conflicts, identifying and changing negative thought patterns, enhancing interpersonal relationships, promoting relaxation through hypnosis. Answer: identifying and changing negative thought patterns. Rationale: CBT targets the negative thoughts that contribute to anxiety, helping clients reframe and challenge those patterns. Option A, unconscious conflicts, relates to psychoanalysis. Option C, interpersonal relationships, is a focus of interpersonal therapy. And option D, relaxation through hypnosis, is not the core of CBT. 11. A client diagnosed with generalized anxiety disorder frequently complains of muscle tension. Which medication class is most effective for this symptom? Benzodiazepines. Selective serotonin reuptake inhibitors, SSRIs. Beta blockers. Anticonvulsants. Answer: benzodiazepines. Rationale: benzodiazepines are effective for rapid relief of physical symptoms like muscle tension and anxiety. Option B, SSRIs, are first-line treatments for anxiety, but take weeks to show effect. Option C, beta blockers, address physical symptoms like tachycardia. And option D, anticonvulsants, are not commonly used for muscle tension and anxiety disorders. 12. Which neurotransmitter imbalance is most commonly associated with anxiety disorders? Dopamine, serotonin, acetylcholine, gamma-aminobutyric acid, GABA. Answer: gamma-aminobutyric acid, GABA. Rationale: GABA is the primary inhibitory neurotransmitter, and its dysregulation is strongly linked to anxiety disorders. Option B, serotonin, plays a role but is more associated with mood regulation. Option A, dopamine, is primarily linked to reward pathways. And option C, acetylcholine, relates to cognitive and motor functions rather than anxiety. 13. A nurse is providing education on panic attacks. Which statement by the client indicates an accurate understanding? Panic attacks are always triggered by stress. Panic attacks are brief and resolve within minutes. I will lose consciousness during a panic attack. Panic attacks only happen in anxiety disorders. Answer: panic attacks are brief and resolve within minutes. Rationale: panic attacks typically peak within 10 minutes and resolve within 20 to 30 minutes. Option A is incorrect as they can occur unexpectedly. Option C is incorrect as panic attacks rarely cause loss of consciousness, and option D is incorrect as panic attacks can occur in conditions like PTSD or even independently of anxiety disorders. 14. What is the primary goal of exposure therapy in treating specific phobias? Avoiding feared stimuli, reducing physical symptoms of anxiety, gradual desensitization to the fear, replacing fear with relaxation. Answer: gradual desensitization to the fear. Rationale: exposure therapy involves repeated exposure to the feared object or situation in a controlled way, reducing the anxiety over time. Option A, avoiding feared stimuli, reinforces the fear. Option B, reducing physical symptoms, is a secondary outcome. And option D, replacing fear with relaxation, is a technique used alongside exposure, but not its primary goal. 15. A client with PTSD experiences flashbacks. Which intervention should the nurse prioritize during these episodes? Encourage the client to suppress the memory. Assist the client in grounding to the present. Suggest avoiding all triggers. Discuss the traumatic event in detail. Answer: assist the client in grounding to the present. Rationale: grounding techniques help the client focus on the present moment and reduce the intensity of the flashback. Option A, suppressing the memory, is unhelpful. Option C, avoiding triggers, is impractical. And option D, discussing the trauma, should occur in a controlled therapeutic environment, not during a flashback. 16. Which physiological response is most characteristic of a fight-or-flight reaction during acute anxiety? Increased salivation, decreased heart rate, pupillary dilation, hypotension. Answer: pupillary dilation. Rationale: the fight-or-flight response, mediated by the sympathetic nervous system, includes pupillary dilation to improve vision. Option A, increased salivation, is incorrect as salivation decreases. Option B, decreased heart rate, is incorrect as heart rate increases. And option D, hypotension, is incorrect as blood pressure typically rises during acute anxiety. 17. A client is prescribed propranolol for performance anxiety. What is the expected benefit of this medication in such cases? Reduces cognitive distortions, prevents intrusive thoughts, minimizes physical symptoms of anxiety, improves focus and concentration. Answer: minimizes physical symptoms of anxiety. Rationale: propranolol, a beta blocker, reduces physical symptoms like tachycardia and tremors during performance anxiety. Option A, reducing cognitive distortions, and option B, preventing intrusive thoughts, are incorrect as propranolol does not affect cognition directly. And option D, improving focus, is not the primary mechanism of action for beta blockers. 18. Which symptom differentiates generalized anxiety disorder, GAD, from other anxiety disorders? Recurrent panic attacks, fear of specific objects, persistent, excessive worry about various topics, avoidance of social interactions. Answer: persistent, excessive worry about various topics. Rationale: GAD is characterized by excessive worry about multiple aspects of life, often without a clear focus. Option A, recurrent panic attacks, describes panic disorder. Option B, fear of specific objects, describes specific phobias. And option D, avoidance of social interactions, describes social anxiety disorder. 19. A client diagnosed with panic disorder is prescribed alprazolam. What is the most important teaching point for this medication? Avoid driving or operating machinery. Take the medication with food. Do not skip a dose. Limit fluid intake while on this drug. Answer: avoid driving or operating machinery. Rationale: alprazolam is a benzodiazepine that can cause drowsiness and impaired coordination, making activities like driving unsafe. Option B, taking with food, is not necessary. Option C, not skipping doses, applies to chronic medications rather than as needed anxiolytics. And option D, limiting fluid intake, is unrelated to benzodiazepine use. 20. Which of the following is a hallmark symptom of social anxiety disorder? Fear of having a panic attack, excessive worry about daily activities, avoidance of public speaking and social settings, recurrent flashbacks of trauma. Answer: avoidance of public speaking and social settings. Rationale: Social anxiety disorder involves an intense fear of embarrassment or judgment in social situations, leading to avoidance. Option A, fear of panic attacks, describes panic disorder. Option B, excessive worry, is more characteristic of generalized anxiety disorder. And option D, flashbacks, pertains to PTSD. 21. What is the primary action of cognitive behavioral therapy, CBT, in treating anxiety disorders? Addresses past traumatic experiences. Reduces physical symptoms of anxiety. Modifies distorted thought patterns. Enhances relaxation through breathing exercises. Answer: modifies distorted thought patterns. Rationale: CBT focuses on identifying and restructuring maladaptive thoughts that contribute to anxiety. Option A, addressing past trauma, applies more to trauma-focused therapy. Option B, reducing physical symptoms, is a secondary outcome. And option D, breathing exercises, is a relaxation technique, but not the primary action of CBT. 22. A nurse is educating a client about buspirone. What is an important point to include? It can cause dependency with long-term use. It works immediately to reduce anxiety. Take it consistently, as prescribed, for best results. Avoid dairy products while taking this medication. Answer: take it consistently, as prescribed, for best results. Rationale: buspirone is a non-benzodiazepine anxiolytic that requires consistent dosing to achieve therapeutic effects, often taking 2 to 4 weeks to work. Option A, dependency, is incorrect as buspirone has a low potential for abuse. Option B, immediate relief, is false as it does not act quickly. And option D, avoiding dairy, is not applicable to buspirone. 23. A client experiencing a panic attack reports feeling like I'm dying. What is the best nursing intervention? Administer oxygen immediately. Encourage slow, deep breathing. Call for emergency medical assistance. Administer an as-needed benzodiazepine. Answer: encourage slow, deep breathing. Rationale: slow, deep breathing reduces hyperventilation and helps alleviate the physical symptoms of a panic attack. Option A, oxygen, is unnecessary unless hypoxia is present. Option C, emergency medical assistance, is not typically required. And option D, benzodiazepine, should be used only if prescribed and non-pharmacologic methods are ineffective. 24. Which of the following differentiates obsessive-compulsive disorder, OCD, from generalized anxiety disorder, GAD? The presence of compulsions to reduce anxiety. Chronic, excessive worry about life events. Avoidance of specific triggers. Physical symptoms like muscle tension. Answer: the presence of compulsions to reduce anxiety. Rationale: OCD is characterized by repetitive behaviors, compulsions, performed to reduce anxiety caused by intrusive thoughts. Option B, chronic worry, is associated with GAD. Option C, avoidance, is seen in phobias or PTSD. And option D, physical symptoms, is more common in GAD. 25. What is the primary side effect of long-term benzodiazepine use in treating anxiety disorders? Weight gain, cognitive impairment, and dependency. Increased anxiety symptoms. Skin rashes. Answer: cognitive impairment and dependency. Rationale: long-term benzodiazepine use can result in cognitive issues and physical or psychological dependency. Option A, weight gain, is not a typical side effect. Option C, increased anxiety, may occur with abrupt withdrawal. And option D, skin rashes, is uncommon. 26. A client undergoing exposure therapy for agoraphobia reports severe anxiety during a session. What should the therapist do? End the session immediately. Encourage the client to use relaxation techniques. Increase the intensity of the exposure. Avoid discussing the client's fears. Answer: encourage the client to use relaxation techniques. Rationale: relaxation techniques help manage anxiety during exposure therapy, ensuring the client stays engaged. Option A, ending the session, reinforces avoidance behavior. Option C, increasing intensity, may overwhelm the client. And option D, avoiding discussion, contradicts therapeutic goals. 27. A client with generalized anxiety disorder, GAD, reports feeling restless and has difficulty concentrating. Which of the following would be most appropriate to assess? Coping mechanisms, and social support. Physical symptoms of anxiety. Substance use history. History of trauma. Answer: physical symptoms of anxiety. Rationale: GAD often includes physical symptoms like restlessness, muscle tension, and fatigue. Option A, coping mechanisms, and option B, substance use, are also relevant but are secondary to assessing the physical symptoms of anxiety. Option D, trauma, may be relevant in PTSD but is less central in GAD. 28. Which neurotransmitter is most commonly implicated in the pathophysiology of anxiety disorders? Dopamine, serotonin, gamma-aminobutyric acid GABA, norepinephrine. Answer: gamma-aminobutyric acid GABA. Rationale: GABA is the primary inhibitory neurotransmitter that regulates anxiety. Option A, dopamine, is more associated with mood disorders. Option B, serotonin, is linked to mood regulation. And option D, norepinephrine, plays a role in arousal and the stress response, but is not the primary neurotransmitter in anxiety. 29. What is a key symptom that distinguishes panic disorder from generalized anxiety disorder? Recurrent, unexpected panic attacks. Chronic worry about everyday events. Social avoidance due to fear of judgment. Preoccupation with health concerns. Answer: recurrent, unexpected panic attacks. Rationale: panic disorder is characterized by unexpected, recurrent panic attacks, which is not a feature of GAD. Option B, chronic worry, is the hallmark of GAD. Option C, social avoidance, is seen in social anxiety disorder. And option D, preoccupation with health, is associated with health anxiety. 30. Which of the following best describes the goal of exposure therapy in the treatment of anxiety disorders? To identify triggers of anxiety. To gradually reduce avoidance behavior. To increase self-esteem and confidence. To resolve underlying trauma. Answer: to gradually reduce avoidance behavior. Rationale: exposure therapy helps clients confront their fears in a controlled way, reducing avoidance. Option A, identifying triggers, is important but not the goal. Option C, self-esteem, is not the primary focus of exposure therapy. And option D, resolving trauma, applies more to trauma-focused therapy. 31. Which of the following is a characteristic feature of a panic attack? Physical symptoms such as chest pain and shortness of breath. Excessive worry over everyday situations. Fear of social judgment or embarrassment. Preoccupation with health. Answer: physical symptoms such as chest pain and shortness of breath. Rationale: panic attacks involve intense physical symptoms such as chest pain, shortness of breath, and palpitations. Option B, excessive worry, describes GAD. Option C, fear of judgment, is characteristic of social anxiety disorder. And option D, preoccupation with health, refers to health anxiety. 32. What is the first-line treatment for generalized anxiety disorder? Antidepressants, benzodiazepines, cognitive behavioral therapy, CBT, antipsychotic medications. Answer: cognitive behavioral therapy, CBT. Rationale: CBT is the first-line treatment for GAD as it helps address the cognitive distortions and behaviors associated with anxiety. Option A, antidepressants, is often used but not the first choice. Option B, benzodiazepines, are used for short-term relief but are not recommended for long-term treatment. And option D, antipsychotics, are not indicated for GAD. 33. A client diagnosed with social anxiety disorder is afraid to speak in public. What is the most appropriate intervention to help this client? Exposure therapy to practice public speaking. Prescribing medication for immediate anxiety relief. Teaching relaxation techniques before social situations. Encouraging avoidance of public speaking situations. Answer: exposure therapy to practice public speaking. Rationale: exposure therapy helps the client gradually confront the fear of public speaking in a controlled manner, reducing anxiety over time. Option B, medication, may help temporarily, but it doesn't address the underlying issue. Option C, relaxation techniques can be helpful, but exposure therapy is more effective for overcoming social anxiety. And option D, avoidance, reinforces the fear. 34. Which medication class is commonly used in the long-term management of generalized anxiety disorder, GAD? Benzodiazepines. Selective serotonin reuptake inhibitors, SSRIs. Antihistamines. Antipsychotics. Answer: selective serotonin reuptake inhibitors, SSRIs. Rationale: SSRIs are the first-line treatment for GAD because they effectively regulate serotonin, improving anxiety symptoms over time. Option A, benzodiazepines, are used for short-term relief but are not recommended for long-term use due to dependence. Option C, antihistamines, are not effective for GAD. And Option D, antipsychotics, are not commonly used for GAD. 35. What is a key component of cognitive restructuring in cognitive behavioral therapy, CBT, for anxiety disorders? Identifying and challenging irrational thoughts. Encouraging avoidance of feared situations. Increasing self-awareness through mindfulness. Expressing anger in a controlled manner. Answer: identifying and challenging irrational thoughts. Rationale: cognitive restructuring in CBT involves identifying and challenging irrational or distorted thoughts that contribute to anxiety. Option B, encouraging avoidance, contradicts the principles of exposure therapy. Option C, mindfulness, is helpful but not a primary focus in CBT for anxiety. And Option D, expressing anger, is more relevant in anger management therapy. 36. What is a common trigger for a panic attack in individuals with panic disorder? A stressful life event. Physical activity or exertion. A change in routine. A specific phobia. Answer: a stressful life event. Rationale: stressful life events are common triggers for panic attacks as they can exacerbate anxiety symptoms. Option B, physical activity, can trigger some symptoms but is not a primary cause. Option C, change in routine, is less likely to trigger a panic attack. And Option D, specific phobia, is related to specific situations, not panic disorder. 37. Which of the following is a typical physical symptom associated with social anxiety disorder? Increased heart rate when interacting socially. Muscle weakness and fatigue. Excessive salivation. Sweating during intense worry. Answer: increased heart rate when interacting socially. Rationale: social anxiety often causes physical symptoms like a rapid heart rate when in social situations due to fear of judgment. Option B, muscle weakness, is not a hallmark of social anxiety disorder. Option C, excessive salivation, is not typically seen. And Option D, sweating, could occur but is more specific to panic attacks. 38. Which of the following is a common co-occurring disorder in individuals with anxiety disorders? Schizophrenia. Major depressive disorder. Bipolar disorder. Attention deficit hyperactivity disorder, ADHD. Answer: major depressive disorder. Rationale: anxiety disorders and depression often occur together, as individuals with anxiety are at higher risk for developing depression. Option A, schizophrenia, is a psychotic disorder. Option C, bipolar disorder, is a mood disorder. And Option D, ADHD, is not commonly co-occurring with anxiety disorders. 39. A nurse is educating a client with panic disorder about lifestyle modifications to reduce symptoms. Which of the following should the nurse include in the teaching? Avoid caffeine and other stimulants. Limit social interactions. Engage in intense physical exercise. Focus on negative thoughts to decrease anxiety. Answer: avoid caffeine and other stimulants. Rationale: stimulants such as caffeine can trigger or exacerbate panic attacks. Option B, limiting social interactions, may increase isolation. Option C, intense exercise, can sometimes increase anxiety. And Option D, focusing on negative thoughts, reinforces the problem rather than alleviating it. 40. Which of the following is a potential side effect of SSRIs used in the treatment of anxiety disorders? Increased anxiety. Weight loss. Sexual dysfunction. Skin rash. Answer: sexual dysfunction. Rationale: SSRIs, though effective for anxiety, can cause side effects like sexual dysfunction. Option A, increased anxiety, is a short-term effect that typically improves. Option B, weight loss, is not common with SSRIs. And Option D, skin rash, is rare. 41. A client with social anxiety disorder is undergoing cognitive behavioral therapy, CBT. Which of the following would most likely be a focus of therapy? Learning to identify and challenge negative self-talk. Engaging in group therapy to reduce fear. Avoiding social situations to reduce anxiety. Increasing physical activity to manage stress. Answer: learning to identify and challenge negative self-talk. Rationale: CBT for social anxiety disorder often focuses on identifying and challenging the negative thoughts that fuel the anxiety in social situations. Option B, group therapy, may be helpful but is not always a focus initially. Option C, avoiding situations, goes against the principles of exposure therapy. And option D, increasing physical activity, is not the primary focus. 42. Which of the following is the primary concern when using benzodiazepines for anxiety disorders? Risk of addiction and dependence. Severe allergic reactions. Weight gain. Increased energy levels. Answer: risk of addiction and dependence. Rationale: benzodiazepines are effective for short-term anxiety relief, but long-term use can lead to dependence and addiction. Option B, allergic reactions, is rare. Option C, weight gain, is not a common side effect. And option D, increased energy, is not typical. 43. What is the primary aim of relaxation techniques in the treatment of anxiety disorders? To reduce the physical symptoms of anxiety. To identify irrational thoughts. To increase social interactions. To encourage avoidance of stressors. Answer: to reduce the physical symptoms of anxiety. Rationale: relaxation techniques like deep breathing and progressive muscle relaxation aim to alleviate the physical symptoms of anxiety, such as tension and rapid heartbeat. Option B, identifying thoughts, is more related to CBT. Option C, social interactions, and option D, avoidance, are not goals of relaxation techniques. 44. A nurse is teaching a client with anxiety about managing anxiety during a stressful event. Which of the following techniques is most appropriate? Deep breathing exercises. Avoidance of stressful situations. Taking over-the-counter sedatives. Engaging in vigorous physical activity. Answer: deep breathing exercises. Rationale: deep breathing is a relaxation technique that helps reduce anxiety during stressful situations. Option B, avoidance, is counterproductive. Option C, sedatives, should be avoided due to dependency risks. And option D, vigorous activity, could increase anxiety. 45. A client with post-traumatic stress disorder, PTSD, reports having nightmares. Which of the following interventions is most likely to help reduce this symptom? Imagery rehearsal therapy. Social skills training. Psychoanalysis. Pharmacotherapy with antipsychotics. Answer: imagery rehearsal therapy. Rationale: imagery rehearsal therapy helps clients with PTSD change the way they experience nightmares by imagining a different, less distressing ending. Option B, social skills training, is not focused on trauma symptoms. Option C, psychoanalysis, is not evidence-based for PTSD. And option D, antipsychotics, is not typically used for nightmares in PTSD. 46. Which is a hallmark feature of obsessive-compulsive disorder, OCD, that can differentiate it from other anxiety disorders? Repetitive, ritualistic behaviors or thoughts. Chronic worry about future events. Avoidance of social situations. Physical symptoms like palpitations. Answer: repetitive, ritualistic behaviors or thoughts. Rationale: OCD is characterized by intrusive, obsessive thoughts and compulsive behaviors. Option B, chronic worry, is more indicative of GAD. Option C, social avoidance, relates to social anxiety disorder. And option D, palpitations, may occur in various anxiety disorders but is not specific to OCD. 47. A nurse is caring for a client with an anxiety disorder. Which of the following is the most important action to promote relaxation during an anxiety episode? Encourage slow, deep breathing. Encourage the client to speak about their fears. Allow the client to be alone in a quiet room. Offer distractions like reading material. Answer: encourage slow, deep breathing. Rationale: slow, deep breathing helps reduce the physiological symptoms of anxiety, such as rapid heart rate and shallow breathing. Option B, speaking about fears, may not be helpful during an acute anxiety episode. Option C, quiet room, may help but does not address the physiological symptoms, and option D, distractions, may be less effective than direct relaxation techniques. 48. A client with generalized anxiety disorder, GAD, reports feeling overwhelmed with constant worry. Which of the following is a first-line treatment? A. Cognitive behavioral therapy, CBT. B. Beta blockers. C. Benzodiazepines. D. Antipsychotics. Answer: Cognitive behavioral therapy, CBT. Rationale: CBT is a first-line treatment for GAD, focusing on changing negative thought patterns. Medications like SSRIs and SNRIs can also be used, but therapy is the first-line approach. 49. Which of the following medications is often prescribed for panic disorder to prevent panic attacks? A. Selective serotonin reuptake inhibitors, SSRIs. B. Benzodiazepines.
C. Antipsychotics.
D. Lithium. Answer: Selective serotonin reuptake inhibitors, SSRIs. Rationale: SSRIs are commonly prescribed to manage panic disorder and prevent future panic attacks. Benzodiazepines may be used for immediate relief, but are not for long-term management. 50. A nurse is providing education to a client on how to manage panic attacks. Which of the following interventions is most appropriate? A. Encourage the client to practice deep breathing. B. Suggest immediate use of medication. C. Advise avoiding all social situations. D. Recommend frequent caffeine intake. Answer: Encourage the client to practice deep breathing. Rationale: Deep breathing helps control hyperventilation and anxiety symptoms during a panic attack. It's a non-pharmacological approach and promotes relaxation. 51. Which of the following is a common symptom of social anxiety disorder? A. Feeling of constant fatigue. B. Fear of being judged or criticized in social situations. C. Persistent thoughts of harming others. D. Severe memory loss. Answer: Fear of being judged or criticized in social situations. Rationale: The fear of being judged or evaluated by others is a hallmark symptom of social anxiety disorder. 52. A nurse is caring for a client with panic disorder. Which of the following is a common symptom during a panic attack? A. Shortness of breath and a feeling of choking. B. Excessive sleepiness. C. Chronic headaches. D. High blood pressure. Answer: Shortness of breath and a feeling of choking. Rationale: Panic attacks often involve physical symptoms like shortness of breath, a choking sensation, and increased heart rate. These are common during an attack. 53. What is a primary goal of cognitive behavioral therapy, CBT, for clients with anxiety disorders? A. To help clients confront irrational thoughts. B. To prescribe medication for anxiety. C. To use relaxation techniques exclusively. D. To isolate clients from triggering situations. Answer: To help clients confront irrational thoughts. Rationale: CBT helps individuals identify and challenge irrational thoughts, which contributes to managing anxiety. It is not solely about relaxation or isolation. 54. A client with a diagnosis of generalized anxiety disorder is prescribed an SSRI. Which of the following is the primary action of SSRIs? A. They increase serotonin levels in the brain. B. They decrease dopamine production. C. They block GABA receptors. D. They increase norepinephrine in the brain. Answer: They increase serotonin levels in the brain. Rationale: SSRIs work by increasing serotonin levels in the brain, which helps regulate mood and anxiety. They do not primarily affect dopamine or norepinephrine. 55. A nurse is assessing a client with obsessive-compulsive disorder, OCD. Which behavior would the nurse most likely observe? A. Repeating rituals such as hand-washing. B. Avoiding all social interactions. C. Experiencing hyperactivity and racing thoughts. D. Displaying aggressive behaviors. Answer: Repeating rituals such as hand-washing. Rationale: OCD is characterized by repetitive behaviors, compulsions, such as hand-washing to relieve anxiety from obsessive thoughts. 56. What is the most common comorbid condition with anxiety disorders? A. Depression. B. Schizophrenia. C. Bipolar disorder. D. Autism spectrum disorder. Answer: depression. Rationale: depression is the most common comorbidity with anxiety disorders, often occurring together in individuals. 57. Which of the following is a recommended first-line treatment for social anxiety disorder? A. Antidepressants like SSRIs. B. Benzodiazepines. C. Electroconvulsive therapy, ECT.
D. Antipsychotics.
Answer: antidepressants like SSRIs. Rationale: SSRIs, a type of antidepressant, are often prescribed as first-line treatment for social anxiety disorder to help alleviate symptoms. 58. A client with panic disorder experiences a sudden onset of extreme fear and physical symptoms like heart palpitations. Which is the best immediate intervention? A. Encourage the client to use slow, deep breathing. B. Administer an antipsychotic medication. C. Have the client exercise to burn off energy. D. Isolate the client in a quiet room. Answer: encourage the client to use slow, deep breathing. Rationale: deep breathing can help regulate the body's response to a panic attack and reduce symptoms like heart palpitations. 59. Which of the following is an example of an environmental trigger for anxiety? A. Stressful work conditions. B. Lack of sleep. C. Certain medications. D. A traumatic event. Answer: stressful work conditions. Rationale: environmental triggers like stress from work can worsen or provoke anxiety symptoms. Other options may also contribute, but are not environmental. 60. A client has been diagnosed with generalized anxiety disorder, GAD. Which of the following nursing interventions is most appropriate? A. Encourage the client to discuss their feelings of worry. B. Ignore the client's concerns to avoid reinforcement of the behavior. C. Provide physical activities to distract from anxiety. D. Recommend that the client avoid all social interactions. Answer: encourage the client to discuss their feelings of worry. Rationale: encouraging open communication about worries helps the client process their anxiety. Avoiding concerns or isolating them can exacerbate symptoms. 61. Which of the following is a hallmark characteristic of generalized anxiety disorder, GAD? A. Recurrent panic attacks. B. Excessive, uncontrollable worry. C. Fear of social interactions. D. Flashbacks of traumatic events. Answer: excessive, uncontrollable worry. Rationale: GAD is characterized by chronic, excessive worry about various life situations. Other options describe symptoms of other anxiety disorders. 62. What is the primary benefit of cognitive behavioral therapy, CBT, for treating anxiety disorders? A. It helps identify and change irrational thought patterns. B. It administers medication to reduce anxiety symptoms. C. It promotes the use of relaxation techniques only. D. It encourages clients to avoid anxiety-provoking situations. Answer: it helps identify and change irrational thought patterns. Rationale: CBT is focused on identifying and altering negative thought patterns to reduce anxiety. Relaxation techniques may be used, but they are secondary to cognitive changes. 63. What is a common side effect of benzodiazepines, often prescribed for short-term anxiety relief? A. Weight gain. B. Drowsiness and sedation. C. Increased energy. D. Memory loss and hallucinations. Answer: drowsiness and sedation. Rationale: benzodiazepines are sedative medications and can cause drowsiness, fatigue, and sedation. Other options do not commonly reflect side effects of benzodiazepines. 64. Which medication class is typically prescribed for the long-term treatment of generalized anxiety disorder, GAD? A. Antidepressants, SSRIs/SNRIs. B. Beta blockers.
C. Antipsychotics.
D. Antihistamines. Answer: antidepressants, SSRIs/SNRIs. Rationale: SSRIs and SNRIs are first-line treatments for long-term management of GAD, as they help regulate serotonin and norepinephrine levels. 65. What is a critical aspect of the nursing assessment for a client presenting with panic disorder? A. Assessing for feelings of hopelessness. B. Identifying possible physical symptoms, such as chest pain. C. Encouraging the client to avoid all stressors. D. Focusing solely on the client's medical history. Answer: identifying possible physical symptoms, such as chest pain. Rationale: panic disorder often presents with physical symptoms like chest pain and palpitations. These must be assessed to rule out other conditions like a heart attack. 66. A client with social anxiety disorder is avoiding social gatherings due to fear of being judged. Which of the following is the best intervention? A. Encourage the client to gradually face social situations. B. Recommend complete avoidance of social events. C. Provide a prescription for sedative medication. D. Suggest that the client stay home until anxiety decreases. Answer: encourage the client to gradually face social situations. Rationale: gradual exposure to anxiety-provoking situations helps desensitize the client to their fear, fostering better coping skills. 67. Which of the following is an example of a cognitive symptom of anxiety? A. Rapid breathing. B. Increased heart rate. C. Excessive worry. D. Muscle tension. Answer: excessive worry. Rationale: cognitive symptoms of anxiety include excessive worry and fear. Physical symptoms, like rapid breathing or increased heart rate, are more physiological manifestations. 68. What should a nurse do if a client with generalized anxiety disorder, GAD, expresses concern about the effects of their medication? A. Encourage the client to stop taking the medication. B. Reassure the client and offer to review the side effects with the doctor. C. Suggest an alternative treatment immediately. D. Ignore the client's concerns and continue treatment. Answer: reassure the client and offer to review the side effects with the doctor. Rationale: it's important to listen to the client's concerns and provide information to ease anxiety. Working with the physician to address side effects is key. 69. Which of the following disorders is most likely to coexist with anxiety disorders? A. Schizophrenia. B. Substance abuse. C. Autism spectrum disorder. D. Obsessive-compulsive disorder, OCD. Answer: substance abuse. Rationale: anxiety disorders often coexist with substance abuse, as individuals may use substances to self-medicate anxiety symptoms. 70. A client with panic disorder is having a panic attack. Which of the following interventions should the nurse prioritize? A. Provide medication to stop the panic attack immediately. B. Encourage the client to breathe deeply and focus on a calm thought. C. Restrain the client to ensure safety. D. Immediately call for emergency assistance. Answer: encourage the client to breathe deeply and focus on a calm thought. Rationale: deep breathing helps to regulate the body's response to a panic attack, making it one of the most effective interventions. 71. A nurse is assessing a client with social anxiety disorder. Which statement by the client would suggest a diagnosis of social anxiety disorder? A. I am often worried about being evaluated or judged by others in social settings. B. I avoid crowds due to fear of losing control. C. I feel tense when I'm alone in a room. D. I'm always nervous when I have to make a decision. Answer: I am often worried about being evaluated or judged by others in social settings. Rationale: the hallmark symptom of social anxiety disorder is fear of being judged or evaluated by others, particularly in social situations. 72. Which of the following is an example of a behavioral symptom of anxiety? A. Rapid thoughts. B. Muscle tension. C. Avoiding a public speaking event. D. Shortness of breath. Answer: avoiding a public speaking event. Rationale: avoidance behaviors, like avoiding public speaking, are behavioral symptoms of anxiety. The other symptoms are more physical or cognitive. 73. Which of the following interventions would be most helpful for a client with anxiety in a crisis situation? A. Suggest that the client remain in isolation. B. Encourage open communication and provide reassurance. C. Provide detailed instructions for the next week. D. Ignore the client's feelings of distress. Answer: encourage open communication and provide reassurance. Rationale: in a crisis, it is important to validate the client's feelings, offer support, and ensure they feel safe and heard. 74. What is the primary focus of exposure therapy for treating anxiety disorders? A. Gradual exposure to anxiety-provoking stimuli. B. Reducing physical symptoms through medication. C. Focusing on childhood experiences. D. Using relaxation techniques to distract from anxiety. Answer: gradual exposure to anxiety-provoking stimuli. Rationale: exposure therapy involves gradually facing feared situations to reduce anxiety responses over time. 75. Which of the following is a common physical symptom experienced by individuals with panic disorder? A. Chest pain. B. Dizziness. C. Trembling. D. All of the above. Answer: all of the above. Rationale: panic attacks can cause a range of physical symptoms, including chest pain, dizziness, and trembling. 76. What is the most effective long-term treatment for social anxiety disorder? A. Cognitive behavioral therapy, CBT. B. Benzodiazepines. C. Antipsychotics. D. Electroconvulsive therapy, ECT. Answer: cognitive behavioral therapy, CBT. Rationale: CBT is the most effective long-term treatment for social anxiety disorder, focusing on changing negative thought patterns. 77. Which of the following is a common symptom of obsessive-compulsive disorder, OCD? A. Repetitive behaviors like washing hands. B. Extreme fear of being judged by others. C. Recurrent panic attacks. D. Severe mood swings. Answer: repetitive behaviors like washing hands. Rationale: OCD is characterized by obsessive thoughts and compulsive behaviors, such as hand-washing. 78. What is the goal of mindfulness-based therapy for clients with anxiety disorders? A. To teach clients to suppress their anxiety. B. To help clients stay present and non-judgmentally aware of their thoughts. C. To focus on uncovering past traumatic events. D. To encourage clients to avoid stressful situations. Answer: to help clients stay present and non-judgmentally aware of their thoughts. Rationale: mindfulness therapy teaches individuals to become aware of their thoughts and emotions in a non-judgmental way, reducing anxiety over time. 79. A client with panic disorder is prescribed a selective serotonin reuptake inhibitor, SSRI. Which of the following is a common side effect of SSRIs? A. Increased energy. B. Sexual dysfunction. C. Increased appetite. D. Increased blood pressure. Answer: sexual dysfunction. Rationale: sexual dysfunction is a common side effect of SSRIs. Other side effects may include insomnia or gastrointestinal disturbances. 80. Which type of therapy is based on the concept that anxiety is reinforced by avoidance behaviors? A. Psychodynamic therapy. B. Exposure therapy. C. Cognitive behavioral therapy, CBT. D. Humanistic therapy. Answer: exposure therapy. Rationale: exposure therapy is based on the idea that avoidance behaviors maintain anxiety, and gradual exposure helps reduce this fear. 81. Which of the following is most likely to trigger a panic attack in someone with panic disorder? A. Laughing excessively. B. Sudden environmental changes or stress. C. Watching a calm, peaceful video. D. Relaxation exercises. Answer: sudden environmental changes or stress. Rationale: stressful or sudden environmental changes are common triggers for panic attacks, especially in those with panic disorder. 82. Which medication is commonly prescribed to manage anxiety symptoms in generalized anxiety disorder, GAD? A. Antipsychotics. B. SSRIs, selective serotonin reuptake inhibitors. C. Beta blockers. D. Benzodiazepines. Answer: SSRIs, selective serotonin reuptake inhibitors. Rationale: SSRIs are first-line pharmacological treatment for GAD as they help regulate serotonin and are less addictive than benzodiazepines. 83. A nurse is teaching a client with panic disorder about relaxation techniques. Which technique would be most effective for reducing immediate panic symptoms? A. Deep breathing exercises. B. Cognitive restructuring. C. Gradual exposure.
D. Journaling.
Answer: deep breathing exercises. Rationale: deep breathing exercises can immediately help reduce the physical symptoms of panic attacks by activating the parasympathetic nervous system. 84. A client with social anxiety disorder avoids going to parties and social gatherings due to fear of embarrassment. Which therapeutic technique is most effective? A. Systematic desensitization. B. Aversion therapy. C. Flooding. D. Psychoanalysis. Answer: systematic desensitization. Rationale: systematic desensitization involves gradual exposure to feared social situations, helping the client to build tolerance and reduce anxiety. 85. Which of the following is a common comorbidity with generalized anxiety disorder, GAD? A. Schizophrenia. B. Major depressive disorder. C. Bipolar disorder. D. Autism spectrum disorder. Answer: major depressive disorder. Rationale: many individuals with GAD also experience depression due to the chronic worry and stress they endure. 86. What is a key characteristic of a panic attack? A. Gradual onset of symptoms over a period of hours. B. Sudden, intense onset of fear and physical symptoms. C. Persistent low mood for days. D. Constant worry and fear of specific situations. Answer: sudden, intense onset of fear and physical symptoms. Rationale: panic attacks are characterized by a sudden and intense onset of fear or discomfort, often accompanied by physical symptoms like heart palpitations or shortness of breath. 87. What is the primary goal of exposure therapy in treating anxiety disorders? A. To help the patient avoid anxiety-inducing situations. B. To help the patient confront and reduce fear of specific situations. C. To eliminate all sources of stress in the patient's life. D. To allow the patient to express emotions freely. Answer: to help the patient confront and reduce fear of specific situations. Rationale: exposure therapy involves gradually confronting feared situations in a controlled way to reduce the anxiety response over time. 88. Which of the following is a possible physical symptom of anxiety?
A. Nausea.
B. Improved appetite. C. Increased weight gain. D. Loss of sleep. Answer: nausea. Rationale: anxiety can trigger physical symptoms like nausea, dizziness, and stomach upset. Weight gain or loss can occur, but is not as immediate as nausea. 89. Which is an example of a cognitive symptom of anxiety? A. Excessive sweating. B. Muscle tension. C. Rumination on worst-case scenarios. D. Increased heart rate. Answer: rumination on worst-case scenarios. Rationale: cognitive symptoms of anxiety involve negative thought patterns, such as persistent worrying or focusing on worst-case outcomes. 90. What is the role of selective serotonin reuptake inhibitors, SSRIs, in anxiety disorder treatment? A. To suppress emotional responses entirely. B. To block serotonin reuptake, increasing serotonin levels in the brain. C. To increase dopamine and serotonin levels. D. To eliminate feelings of fear or panic immediately. Answer: to block serotonin reuptake, increasing serotonin levels in the brain. Rationale: SSRIs work by increasing serotonin levels in the brain, helping to regulate mood and anxiety over time. 91. Which of the following is an example of a behavioral symptom of social anxiety disorder? A. Excessive worry about future events. B. Fear of being judged in social interactions. C. Avoidance of social interactions. D. Intrusive thoughts and compulsive behaviors. Answer: avoidance of social interactions. Rationale: behavioral symptoms of social anxiety disorder often involve avoidance of situations where the individual might be judged or evaluated by others. 92. Which of the following would be most helpful in managing anxiety in children? A. Medication as the first intervention. B. Creating a calm and predictable environment. C. Encouraging isolation from peers. D. Punishing anxiety-driven behaviors. Answer: creating a calm and predictable environment. Rationale: a calm, structured environment helps children feel safe and secure, which can reduce anxiety. Punishment can exacerbate anxiety, while medication is typically a later intervention. 93. Which is a common coping strategy for people with panic disorder? A. Seeking social support only when necessary. B. Avoiding triggers and stressful situations. C. Engaging in physical activities regularly. D. Deep breathing and grounding exercises. Answer: deep breathing and grounding exercises. Rationale: deep breathing and grounding exercises help to manage the immediate physical and emotional symptoms of a panic attack, grounding the person in the present moment. 94. Which of the following is an effective treatment modality for children with social anxiety disorder? A. Electroconvulsive therapy, ECT. B. Play therapy combined with CBT. C. Long-term medication treatment only. D. Strict discipline and punishment. Answer: play therapy combined with CBT. Rationale: play therapy combined with cognitive behavioral therapy, CBT, is effective for treating anxiety in children, helping them express and cope with their emotions. 95. Which of the following interventions is most appropriate for a client with a severe panic attack in a public setting? A. Encouraging the client to calm down on their own. B. Offering the client reassurance and a quiet space. C. Providing a detailed explanation of the symptoms. D. Encouraging the client to confront the situation immediately. Answer: offering the client reassurance and a quiet space. Rationale: during a panic attack, offering reassurance and a quiet, safe space can help calm the individual. Confronting the situation or offering explanations may worsen the distress. 96. What is the characteristic symptom of agoraphobia? A. Persistent avoidance of crowds and public places due to fear of panic attacks. B. Fear of being judged in social situations. C. Repetitive, intrusive thoughts. D. Avoidance of social media platforms. Answer: persistent avoidance of crowds and public places due to fear of panic attacks. Rationale: agoraphobia is often characterized by a fear of being in situations where escape might be difficult if a panic attack occurs, leading to avoidance of public places. 97. Which of the following best describes the behavioral component of cognitive behavioral therapy, CBT? A. Is identifying and changing negative thought patterns. B. Using medication to control symptoms. C. Learning relaxation techniques to reduce anxiety. D. Engaging in gradual exposure to feared situations. Answer: engaging in gradual exposure to feared situations. Rationale: the behavioral component of CBT includes gradually exposing individuals to feared situations to reduce their anxiety over time. 98. Which of the following is a potential side effect of using benzodiazepines for anxiety management? A. Improved concentration and focus. B. Drowsiness, dizziness, and impaired coordination. C. Increased appetite and weight gain. D. Heightened anxiety and restlessness. Answer: drowsiness, dizziness, and impaired coordination. Rationale: benzodiazepines are sedative medications and can cause drowsiness, dizziness, and impaired motor coordination, especially with prolonged use. 99. What is the first-line treatment for panic disorder? A. Electroconvulsive therapy, ECT. B. Cognitive behavioral therapy, CBT. C. Antidepressant medication only. D. Avoiding situations that trigger panic attacks. Answer: cognitive behavioral therapy, CBT. Rationale: CBT is the most effective first-line treatment for panic disorder, focusing on changing thought patterns and behaviors that contribute to anxiety. 100. Which of the following should be avoided when treating a client with panic disorder who is also prescribed benzodiazepines? A. Engaging in physical exercise. B. Consuming alcohol. C. Eating a healthy diet. D. Practicing relaxation techniques. Answer: consuming alcohol. Rationale: alcohol can increase the sedative effects of benzodiazepines, which may lead to dangerous side effects such as excessive sedation or respiratory depression. 101. What is the primary treatment for social anxiety disorder in children? A. Medication only. B. Cognitive behavioral therapy, CBT, with exposure. C. Psychoanalysis. D. Family therapy. Answer: cognitive behavioral therapy, CBT, with exposure. Rationale: CBT with exposure therapy is a highly effective treatment for children with social anxiety disorder, helping them gradually face their fears in a controlled setting. 102. Which of the following is a characteristic feature of obsessive-compulsive disorder, OCD, related to anxiety? A. Recurrent intrusive thoughts and repetitive behaviors. B. Sudden, severe mood swings. C. Fear of social situations. D. Avoidance of people and activities. Answer: recurrent intrusive thoughts and repetitive behaviors. Rationale: OCD is characterized by obsessions, intrusive thoughts, and compulsions, repetitive behaviors, aimed at reducing anxiety associated with the obsessions. 103. A client is diagnosed with panic disorder. Which of the following should the nurse include in the teaching plan for this client? A. Panic attacks are best treated with avoidance of triggers. B. Deep breathing and relaxation techniques can help reduce panic symptoms. C. Medication should be avoided because it can lead to dependence. D. Physical exercise should be avoided during panic attacks. Answer: deep breathing and relaxation techniques can help reduce panic symptoms. Rationale: deep breathing and relaxation techniques can be helpful in reducing the physiological symptoms associated with panic attacks, such as rapid heart rate and shallow breathing. 104. Which of the following symptoms is common in a client with generalized anxiety disorder, GAD? A. Sudden onset of severe anxiety attacks. B. Worrying excessively about various life situations. C. Avoiding social situations due to fear of judgment. D. Repetitive hand-washing and cleaning behaviors. Answer: worrying excessively about various life situations. Rationale: GAD is characterized by chronic, excessive worry about a variety of life situations, often without a specific trigger. 105. A client with panic disorder is considering taking a medication. Which medication is often prescribed for the management of panic attacks? A. Antipsychotic medications. B. Selective serotonin reuptake inhibitors, SSRIs. C. Antihistamines. D. Opioids. Answer: selective serotonin reuptake inhibitors, SSRIs. Rationale: SSRIs are commonly prescribed for panic disorder to help regulate serotonin levels in the brain and reduce anxiety over time. 106. What is a common side effect of SSRI medications used in the treatment of anxiety disorders? A. Increased appetite and weight gain. B. Nausea, dizziness, and sexual dysfunction. C. Excessive energy and restlessness. D. Severe sedation. Answer: nausea, dizziness, and sexual dysfunction. Rationale: common side effects of SSRIs include nausea, dizziness, and sexual dysfunction, especially during the initial stages of treatment. 107. Which of the following is not a typical behavioral symptom of social anxiety disorder? A. Avoiding eye contact with others. B. Fear of being negatively evaluated in social situations. C. Excessive talking in group settings. D. Avoidance of public speaking. Answer: excessive talking in group settings. Rationale: social anxiety disorder typically involves avoiding social situations due to fear of judgment rather than excessive talking in group settings. 108. What is the role of family therapy in treating anxiety disorders in children? A. To explore childhood trauma. B. To improve family communication and reduce stressors contributing to anxiety. C. To provide medication management for the child. D. To focus solely on behavioral discipline. Answer: to improve family communication and reduce stressors contributing to anxiety. Rationale: family therapy can help identify and address stressors within the family environment that contribute to anxiety, improving communication and support. 109. Which of the following cognitive behavioral techniques helps a client with generalized anxiety disorder, GAD, manage excessive worry? A. Thought stopping. B. Aversion therapy. C. Flooding. D. Cognitive reframing. Answer: thought stopping. Rationale: thought stopping involves interrupting the cycle of excessive worrying by mentally telling oneself, stop, helping the individual gain control over anxious thoughts. 110. Which of the following is a key symptom of separation anxiety disorder in children? A. Fear of being away from parents or primary caregivers. B. Compulsive hand-washing. C. Excessive social interaction. D. Constant nightmares. Answer: fear of being away from parents or primary caregivers. Rationale: Separation anxiety disorder is characterized by excessive fear or anxiety about being separated from attachment figures, often leading to distress when apart. 111. What is the first-line treatment for a client diagnosed with social anxiety disorder? A. Electroconvulsive therapy, ECT. B. Cognitive behavioral therapy, CBT. C. Benzodiazepines. D. Antipsychotic medications. Answer: Cognitive behavioral therapy, CBT. Rationale: CBT is the first-line treatment for social anxiety disorder, helping clients confront and manage their fear of social situations through gradual exposure and cognitive restructuring. 112. A client with panic disorder is afraid of having a panic attack at work. Which of the following should the nurse recommend to address this fear? A. Avoiding stressful work situations. B. Breathing exercises and mindfulness techniques. C. Ignoring the fear and pushing through it. D. Taking a sedative before work. Answer: breathing exercises and mindfulness techniques. Rationale: breathing exercises and mindfulness techniques can help the client manage anxiety in the moment and reduce the fear of panic attacks at work. 113. Which of the following is a risk factor for developing generalized anxiety disorder, GAD? A. Excessive physical activity. B. History of childhood trauma or abuse. C. High self-esteem. D. Low caffeine intake. Answer: history of childhood trauma or abuse. Rationale: a history of trauma or abuse during childhood is a significant risk factor for the development of GAD, as it can lead to chronic anxiety and excessive worry. 114. Which of the following is the primary focus of cognitive behavioral therapy, CBT, in treating anxiety disorders? A. Is identifying and changing maladaptive thought patterns. B. Using medication to regulate brain chemistry. C. Encouraging avoidance of anxiety-provoking situations. D. Analyzing unconscious conflicts from the past. Answer: identifying and changing maladaptive thought patterns. Rationale: CBT focuses on identifying and changing negative thought patterns and behaviors that contribute to anxiety, helping individuals develop healthier coping mechanisms. 115. What is the most appropriate nursing intervention for a client with severe anxiety during a panic attack? A. Encouraging the client to talk about their feelings. B. Providing a quiet, safe environment and reassuring the client. C. Engaging the client in physical activity. D. Giving the client a sedative to calm them. Answer: providing a quiet, safe environment and reassuring the client. Rationale: during a panic attack, providing a calm, quiet space and offering reassurance helps to soothe the client and reduce anxiety. 116. Which of the following is a common cognitive distortion in individuals with anxiety disorders? A. All-or-nothing thinking. B. Excessive rational thinking. C. Overgeneralization of positive outcomes. D. Belief in complete control over anxiety. Answer: all-or-nothing thinking. Rationale: all-or-nothing thinking is a common cognitive distortion in anxiety disorders, where individuals view situations in extremes, e.g., either perfect or a complete failure. 117. Which of the following is a potential long-term effect of untreated generalized anxiety disorder, GAD? A. Increased risk for developing schizophrenia. B. Chronic physical health problems due to prolonged stress. C. Complete elimination of anxiety symptoms. D. Dramatic personality changes. Answer: chronic physical health problems due to prolonged stress. Rationale: untreated GAD can lead to chronic physical health problems such as hypertension, gastrointestinal issues, and weakened immune function due to constant stress. 118. Which of the following is a behavioral strategy for managing social anxiety disorder? A. Engaging in social isolation to avoid anxiety triggers. B. Gradual exposure to feared social situations. C. Relying solely on medication to manage anxiety. D. Avoiding eye contact during social interactions. Answer: gradual exposure to feared social situations. Rationale: gradual exposure to feared social situations is an effective behavioral strategy in CBT to help reduce anxiety and build confidence in social interactions. 119. What is the primary reason for using selective serotonin reuptake inhibitors, SSRIs, in treating anxiety disorders? A. They provide immediate relief of symptoms. B. They help restore the balance of serotonin in the brain. C. They help the client avoid anxiety-provoking situations. D. They increase dopamine levels in the brain. Answer: they help restore the balance of serotonin in the brain. Rationale: SSRIs are used to treat anxiety disorders by increasing serotonin levels in the brain, which helps regulate mood and reduce anxiety over time. 120. Which of the following interventions is most helpful in treating clients with anxiety who are experiencing excessive worry? A. Encouraging avoidance of anxiety triggers. B. Engaging in cognitive reframing and thought-stopping techniques. C. Using a passive, wait-and-see approach. D. Suggesting that the client just relax when anxious. Answer: engaging in cognitive reframing and thought-stopping techniques. Rationale: cognitive reframing and thought-stopping techniques help individuals change negative thought patterns and manage excessive worry, which is central to many anxiety disorders. 121. What is a common physical symptom of anxiety experienced during a panic attack? A. Increased appetite. B. Chest pain and shortness of breath. C. Uncontrolled laughing. D. Nausea and vomiting. Answer: chest pain and shortness of breath. Rationale: physical symptoms of a panic attack often include chest pain and shortness of breath due to rapid breathing, which can mimic heart-related issues. 122. A client with generalized anxiety disorder, GAD, expresses excessive worry about work and personal life. What is the nurse's primary intervention? A. Recommend focusing on one issue at a time. B. Encourage avoidance of stressors. C. Teach relaxation techniques. D. Advise the client to ignore anxious thoughts. Answer: teach relaxation techniques. Rationale: teaching relaxation techniques, such as deep breathing and progressive muscle relaxation, is essential in helping individuals manage anxiety in GAD. 123. Which of the following medications is commonly prescribed for the treatment of anxiety disorders? A. Lithium. B. Benzodiazepines. C. Antidepressants like SSRIs. D. Antipsychotics. Answer: antidepressants like SSRIs. Rationale: SSRIs, selective serotonin reuptake inhibitors, are commonly used to treat anxiety disorders by regulating serotonin levels, which help reduce anxiety symptoms. 124. A nurse is teaching a client with panic disorder about managing symptoms. What should the nurse emphasize as the most effective technique for reducing panic attacks? A. Restricting social interaction. B. Taking deep, slow breaths. C. Drinking large amounts of water. D. Overexercising. Answer: taking deep, slow breaths. Rationale: deep breathing helps reduce the physical symptoms of panic attacks, such as hyperventilation and increased heart rate, by promoting relaxation. 125. Which of the following is a key characteristic of panic disorder? A. Fear of losing control during a panic attack. B. Chronic, excessive worry about future events. C. Recurrent, intrusive thoughts. D. Avoidance of crowds. Answer: fear of losing control during a panic attack. Rationale: one of the defining features of panic disorder is the fear of losing control or dying during a panic attack, which leads to heightened anxiety. 126. What is the best approach to managing a client who experiences social anxiety disorder? A. Gradual exposure to feared situations. B. Immediate administration of sedative medications. C. Complete isolation from social interactions. D. Avoiding any challenging social situations. Answer: gradual exposure to feared situations. Rationale: gradual exposure, a technique used in CBT, helps individuals confront and manage their fears in a controlled, systematic way. 127. Which of the following is not typically a characteristic of generalized anxiety disorder, GAD? A. Persistent worry. B. Sudden episodes of intense fear. C. Physical tension. D. Difficulty concentrating. Answer: sudden episodes of intense fear. Rationale: sudden episodes of intense fear are more characteristic of panic disorder, while GAD involves persistent and excessive worry about various aspects of life. 128. What is the primary goal of cognitive behavioral therapy, CBT, for clients with anxiety disorders? A. To change maladaptive thoughts and behaviors. B. To uncover unconscious memories. C. To prescribe appropriate medications. D. To provide insight into past trauma. Answer: to change maladaptive thoughts and behaviors. Rationale: CBT aims to identify and modify the distorted thought patterns and behaviors that contribute to anxiety, helping individuals develop healthier coping mechanisms. 129. Which of the following is an appropriate intervention for a client experiencing anxiety due to social situations? A. Suggest avoidance of all social events. B. Offer reassurance that social anxiety will resolve on its own. C. Encourage gradual exposure to social settings. D. Suggest limiting all social interaction to avoid discomfort. Answer: encourage gradual exposure to social settings. Rationale: gradual exposure helps reduce anxiety by allowing the client to face their fears in a controlled manner, eventually leading to reduced anxiety in social situations. 130. Which of the following is an appropriate treatment for a client with anxiety disorder who is also diagnosed with depression? A. Cognitive behavioral therapy (CBT) combined with SSRIs. B. Psychoanalysis only. C. Medication only with no therapy. D. Exclusive use of relaxation techniques. Answer: cognitive behavioral therapy (CBT) combined with SSRIs. Rationale: combining CBT with SSRIs is effective for treating both anxiety and depression, as it addresses both the cognitive aspects of anxiety and the serotonin imbalance associated with depression. 131. A nurse is assessing a client with panic disorder. Which symptom is most likely to be observed? A. Disorganized thoughts. B. Chronic headaches. C. Sudden onset of palpitations and fear of death. D. Overly positive thinking. Answer: sudden onset of palpitations and fear of death. Rationale: panic disorder is characterized by sudden, intense feelings of fear or impending doom, along with physical symptoms such as palpitations. 132. Which of the following is an essential first step when treating anxiety disorders in children? A. Building trust and establishing a supportive environment. B. Providing medication immediately. C. Ignoring the child's fears. D. Encouraging avoidance of triggers. Answer: building trust and establishing a supportive environment. Rationale: building trust and a supportive environment is essential to helping children feel safe enough to express their fears and work through their anxiety. 133. What is the purpose of using relaxation techniques in treating anxiety disorders? A. To distract from anxiety-provoking thoughts. B. To increase the level of anxiety for therapeutic purposes. C. To reduce physiological symptoms associated with anxiety. D. To encourage emotional suppression. Answer: to reduce physiological symptoms associated with anxiety. Rationale: relaxation techniques, such as deep breathing and progressive muscle relaxation, help reduce the physical symptoms of anxiety by promoting relaxation and reducing the fight-or-flight response. 134. Which medication is often prescribed for long-term management of generalized anxiety disorder, GAD? A. Benzodiazepines. B. Selective serotonin reuptake inhibitors, SSRIs. C. Antihistamines. D. Barbiturates. Answer: selective serotonin reuptake inhibitors, SSRIs. Rationale: SSRIs are commonly prescribed for long-term management of GAD, as they help regulate serotonin levels and provide sustained relief from anxiety symptoms. 135. What is a key aspect of exposure therapy in treating anxiety disorders? A. Confronting fears in a gradual, controlled manner. B. Completely avoiding all anxiety triggers. C. Immediate and intense confrontation with fears. D. Encouraging suppression of anxious thoughts. Answer: confronting fears in a gradual, controlled manner. Rationale: exposure therapy involves confronting fears slowly and in a controlled way, helping the individual build tolerance and reduce anxiety over time. 136. A client with social anxiety disorder is hesitant to speak in public. What is the most appropriate intervention? A. Encouraging the client to practice in front of a mirror. B. Encouraging avoidance of speaking engagements. C. Dismissing the client's fear as unnecessary. D. Teaching the client to ignore their anxiety. Answer: encouraging the client to practice in front of a mirror. Rationale: gradual practice, such as rehearsing in front of a mirror, can help build confidence and reduce anxiety in social situations like public speaking. 137. Which of the following is most likely to occur when a client with an anxiety disorder is treated with exposure therapy? A. An immediate increase in anxiety symptoms. B. A decrease in anxiety over time with repeated exposure. C. A complete disappearance of anxiety symptoms. D. A permanent aversion to feared situations. Answer: a decrease in anxiety over time with repeated exposure. Rationale: repeated exposure helps desensitize the client to feared situations, leading to reduced anxiety over time as they learn to cope with the anxiety-provoking stimuli. 138. What is a common comorbid condition in clients with anxiety disorders? A. Diabetes mellitus. B. Schizophrenia. C. Depression. D. Hyperthyroidism. Answer: depression. Rationale: depression is commonly comorbid with anxiety disorders, as the chronic stress and worry associated with anxiety can contribute to feelings of hopelessness and sadness. 139. Which of the following is a hallmark symptom of panic disorder? A. Persistent worry about daily life. B. Repetitive hand-washing behaviors. C. Sudden onset of extreme fear or terror. D. Avoidance of social situations. Answer: sudden onset of extreme fear or terror. Rationale: panic disorder is characterized by sudden, intense episodes of fear or terror, often accompanied by physical symptoms such as heart palpitations and shortness of breath. 140. What is the primary focus of treatment for individuals with social anxiety disorder? A. Reducing the frequency of panic attacks. B. Challenging and changing negative thoughts about social situations. C. Limiting all social interactions. D. Encouraging complete social isolation. Answer: challenging and changing negative thoughts about social situations. Rationale: the primary goal in treating social anxiety disorder is to help the individual recognize and challenge negative thoughts about social situations, gradually reducing anxiety. 141. A client with generalized anxiety disorder, GAD, frequently feels restless and has trouble concentrating. Which intervention is most appropriate for this client? A. Encourage relaxation techniques. B. Recommend a high-energy exercise program. C. Suggest complete isolation to avoid anxiety triggers. D. Advise the client to suppress anxious thoughts. Answer: encourage relaxation techniques. Rationale: relaxation techniques like deep breathing, progressive muscle relaxation, and mindfulness can help reduce the physical and mental tension associated with GAD. 142. Which of the following is the most effective initial intervention for a client experiencing a panic attack? A. Speak calmly and provide reassurance. B. Encourage the client to engage in physical activity. C. Avoid any discussion of the panic attack. D. Provide caffeine to reduce anxiety. Answer: speak calmly and provide reassurance. Rationale: offering calm reassurance and support helps reduce the intensity of the panic attack and helps the client feel safe and understood during the episode. 143. A client with panic disorder is prescribed a benzodiazepine. Which statement indicates the client needs further education about the medication? A. I can take this medication when I feel anxious. B. This medication can be taken every day for long-term use. C. I should avoid drinking alcohol while taking this medication. D. I may feel sleepy or dizzy while taking this medication. Answer: this medication can be taken every day for long-term use. Rationale: benzodiazepines are generally prescribed for short-term use due to the risk of dependency, not for long-term daily use. 144. A client is diagnosed with social anxiety disorder. Which behavior would the nurse expect to observe? A. The client avoids public speaking opportunities. B. The client enjoys meeting new people in social settings. C. The client seeks out large crowds to interact with. D. The client is unconcerned about performance in social situations. Answer: the client avoids public speaking opportunities. Rationale: Individuals with social anxiety disorder often avoid situations where they might be the center of attention or judged by others, such as public speaking. 145. Which of the following treatments is commonly used for clients with post-traumatic stress disorder, PTSD, and co-occurring anxiety disorder? A. Psychodynamic therapy. B. Eye movement desensitization and reprocessing, EMDR. C. Deep brain stimulation. D. Antidepressants only. Answer: eye movement desensitization and reprocessing, EMDR. Rationale: EMDR is a recognized therapy for PTSD and anxiety disorders, helping clients process traumatic memories while reducing emotional distress. 146. Which of the following is a major risk factor for developing anxiety disorders? A. History of major depression. B. High socioeconomic status. C. History of substance abuse. D. High levels of job satisfaction. Answer: history of major depression. Rationale: a history of major depression is a significant risk factor for developing anxiety disorders due to overlapping biological and psychological factors. 147. A nurse is caring for a client diagnosed with panic disorder. What should the nurse include in the teaching plan regarding coping with panic attacks? A. Try to avoid any situations that might trigger a panic attack. B. Use breathing exercises to help control the panic symptoms. C. Ignore the panic attack, and it will go away on its own. D. Limit all physical activities to prevent triggering an attack. Answer: use breathing exercises to help control the panic symptoms. Rationale: breathing exercises are a well-established method to manage panic attacks, as they can help regulate the client's breathing and calm their physical symptoms. 148. A client diagnosed with generalized anxiety disorder, GAD, reports excessive worry about daily tasks. What is the nurse's most appropriate response? A. You should try to avoid worrying at all. B. I understand, but try not to let it affect your daily routine. C. Let's discuss how we can break tasks down to make them less overwhelming. D. Worrying is normal, but you should try to ignore the feeling. Answer: let's discuss how we can break tasks down to make them less overwhelming. Rationale: helping the client break tasks into smaller, manageable parts can reduce anxiety by making them feel more in control of their responsibilities. 149. Which of the following is most likely to be a trigger for a client with social anxiety disorder? A. Participating in one-on-one therapy. B. Attending a large, crowded party. C. Engaging in a relaxed conversation with a close friend. D. Reading in a quiet, private setting. Answer: attending a large, crowded party. Rationale: social anxiety disorder is typically triggered by situations involving large crowds, where individuals fear judgment or scrutiny from others. 150. Which of the following is the primary goal of cognitive behavioral therapy, CBT, in treating anxiety disorders? A. To uncover unconscious memories. B. To teach the client to control their environment. C. To identify and challenge irrational thoughts and beliefs. D. To focus on the client's childhood experiences. Answer: to identify and challenge irrational thoughts and beliefs. Rationale: CBT focuses on identifying and modifying irrational or maladaptive thoughts and behaviors which contribute to anxiety in order to promote healthier thinking patterns.